on this episode of In the Rack podcast?
Me, Riley Fake, in this macrocosm of the universe, my goal is to change how people see chiropractic and use chiropractic. Go from a pain-fearing mentality to a pleasure-seeking mentality. I was feeling good. Chiropractic made me feel better.
What you got?
Welcome to In the Rack podcast, where we provide you with a practical framework for breaking PRs in all facets of health and wellness. We are just a couple of bros giving you the simple hows in a world of complex wants. No filters, no scripts, no rules, just straight talk.
Talk to him.
Now, let's get into the rack with your hosts, Dr. Chad and Dr. Nick.
All right, everyone. Welcome to another episode of In the Rack podcast. I'm your host, Chad, and with me is my co-host and fellow physical therapist, Nick. As always, we have a great episode planned for you today, but we do have another guest on this episode, and I'm pretty excited about this one, and I'll explain why in a minute. Her name is Riley Fake, and yes, it is fake as in fake.
Not real.
F-A-K-E.
Yeah, she is here, though.
Yeah,
She's
she
really
is here. No, she's not
really
fake.
here.
Fake.
This could get really confusing for people.
Totally.
Go to the YouTube. You'll see she's an actual person. She's
Yep.
not fake.
Yep. So F-A-K-E, fake. And she is a chiropractor, which is kind of cool. We've only had, how many have we had? Maybe one or two?
Yeah,
Two?
a handful.
Yeah.
Yeah.
Chiropractic. Yeah, we've had a couple chiropractors, which is great. And Riley actually works for a facility known as In8 Wellness Center, which is in North Andover. You have one in Beverly too, is that correct?
Yes, the owners just sold it actually.
Oh, okay. So it's just now North Andover?
Yes.
Awesome. So this is going to be fun because their facility is an out-of-network facility just like ours. So we're going to have a lot of good conversation. And we're also going to have a good conversation selfishly because I found out that Riley actually went to school with Nick,
Yeah, we went
undergrad
together.
and grad school, right?
Yeah.
So, or no, undergrad mainly, right?
Undergrad,
Springfield-
yeah.
At Springfield College.
Yeah.
Mhm.
So I've got some questions for Riley later, and we are going to expose this man today. So
Later.
it's going to be fun.
How much later? My goodness gracious. Wow.
No, we're going to get the deets on Nick today for sure. So I'm excited about this one. But let's start.
I was an altar boy, all right?
We're going to find out from Riley what you actually were. Okay, don't try to comp right now. Okay, we're going to figure it all out.
All right, well, it's
Oh,
better late than never, I suppose.
Yes, it is. So Riley, why don't you tell us a little bit about yourself? Like what made you decide you wanted to go to Springfield College and all this good stuff?
Okay. Well, I'm originally from Rochester, New York. I'm not a Bills fan. Don't worry. I decided to go to Springfield because it was the farthest school away that my parents allowed me to go to.
Fair.
But of course, stepping on campus, as Nick would know, it's a different type of place
It
for
is.
sure.
Sure.
It's very unique and it's very warm and welcoming to athletes, holistic health and wellness, all the things. So I love that right off the bat, and I knew I could play basketball there, which was of course a big one. Went for exercise science, strength and conditioning concentration. So I always wanted to be a strength coach. That was always what I wanted to be. But I did an internship at Holy Cross, and that very quickly changed. I love coaching. I love athletics. But chiropractic got introduced to me through basketball, actually.
cool.
A girl that I played with, her father was a chiro, and he actually adjusted a lot of our athletes. And I had no idea what a chiropractor was. Never heard of one, never been to one.
Sure.
And he goes, "Do you want to get adjusted?" I was like, "Don't mess me up. Like, don't break my neck. Don't break my back." I was really scared. And he was just like, "Well, lay on the table. Pop, 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 pop." Well, I got adjusted the day of a game. Now, for athletes, like, if you do something and it yields something
Totally.
amazing,
Yeah.
like, oh, this is great.
That's it.
Or very
Yeah.
superstitious. So obviously I played a pretty good game. So in my like pea brain, I was like, chiropractic makes you play better basketball. Like that's
My
what
pea
it was.
brain.
So that's why I loved Springfield. It introduced me to a lot of things, and of course introduced me to
Yeah.
what I'm actually doing now.
I love it.
So
That's awesome. So what made you, so now you went to school with Nick
yes.
and you went through is it a 4-year and then you go off to a 3-year graduate school?
Yes.
Is that how it works?
So
Yeah.
4 years of undergrad and then 3.5 years of chiropractic school, but it's a 5-year program. So you can do semesters. You can do fall semester, spring semester, but I went to school in trimesters. So all year round. So I finished the 5-year program in 3.5 years.
Okay, so you sped it up.
Yes.
Gotcha.
And then you have to take 5 board exams. 4, technically, you can take an optional one, which most states require, but it is 4
Whoa.
board exams. Yeah.
4 board exams to become a licensed chiropractor?
Yes.
You
To
know we
become
only
a-
have one, right?
Respect.
I respect that.
Yeah. To become
I
to
did not
become
know
a
that.
to become a doctor of chiropractic, then you have to take each state licensure
Interesting.
exam.
So it's not a
process.
standardized test through all states.
No.
No wonder we don't get the doctor title.
It's all
We
making
just
sense now.
We just take one test. I mean, that's so easy. One test.
I
Come on
mean,
now.
at least give me one more.
Yeah,
And the
you know,
first-
at least make it 2.
And the first 2 tests, your first 2 board exams, have 6 tests within that exam.
Whoa.
So you are
Wow.
in
So you have to be a mathematician to also be a chiropractor.
exactly. you are there all day. Your first test is anatomy and physiology. Your next test is microbiology. Your next test is neuroscience. And you take 2 of those. So 12 tests first. Then you take a part 3, which is a part practical, part written. And then your part 4 is a practical exam where you have mock patients,
Yeah. Okay.
mock exams.
See,
Yeah.
I think that's the way it should be, honestly.
Yeah,
I agree.
sure.
I think that, I mean, should there be 6 tests? I don't know. But like, I think there should be some sort of lab portion of the exam because
100%.
I know
Absolutely.
tons of people,
Absolutely.
not only that I went to school with, but people that I actually know personally that I wouldn't let touch me with a 10-foot pole.
100%.
And I'm sure you do, and I know you do.
Yeah, absolutely.
So it's like one of those things where it's like, how do we actually know,
Yeah.
you know, what our actual clinical skills are going to be?
I know for me, like in the PT program in Springfield, like my specific class, some of the best PTs now were the worst test takers.
No doubt.
Absolutely.
Yep.
Like that's just the way it is. You can be a great test taker. So there absolutely should be. And in PT school, like for us, there was the practical portion, but it was within your institution. It wasn't like
That's right.
part of the board exam. But
Yep.
I think part of the board exam would be super interesting because now there's no comfortability there where it's like, oh, I know my instructors. I've gotten to know them over the last 3 years. I know my.
It's also not biased because think about it. Like when it's
Exactly,
at your institution, like
Yeah, for
nobody wants to
sure.
have a bad fail rate, right?
Yeah,
so like
absolutely.
everybody's going to pass. So
with that test, is there anything? Because I know, like in nursing, once you get enough questions right, it just shuts off,
Yep.
and you're like, you either know you passed or you got too many wrong. Does it do that, or you have
No.
to just
You
go
gotta
through it all?
complete
yours
the
did
whole
that.
thing.
Mine didn't do that.
No, it's a nursing thing. No.
This makes total sense now.
Yeah. Well, yeah, no, I got through like 10 questions and it just shut off, and I was like, they're like, here, you're a doctor now. So like, I was like, oh, sweet, I got all 10 right. Thanks. No, but I know it's not that way in PT, but I know
Yeah.
in nursing it is
Oh,
that way with
see, I
with their board exam.
Yeah, I've heard that with
So,
a couple
yeah.
other like practitioner type
Yeah.
of tests. But yeah, with your first part 1 and 2, if you don't pass all 6 parts, so you fail 2 of them, you can retake just those
Just
2.
the 2. Okay.
But if you fail
All right.
3 or more,
Then gotta
you have
all-
to take the
all of them.
whole 6 of them
Dang.
again.
Okay.
Yeah.
Okay.
But that
All right.
practical portion, what Nick just said too, some of the best chiros that crushed parts 1 and 2 that were just written tests blew it up on parts 3 and 4
Yeah,
because
for
they
sure.
had that practical portion that their bedside manner wasn't. You get tested on that, you get
Yeah.
tested on your touch, you get tested on everything because you actually have a mock patient and you have a person watching you interact with this patient.
Yeah.
How do you take an
Like that.
exam? It's not just adjusting.
Yeah.
Right.
You had to do a history.
Totally.
You had to diagnose.
Yeah,
You had to
for
look
sure.
at X-rays. All
Yeah,
that type
yeah,
of
yeah,
stuff.
yeah.
Yeah.
That almost makes me question like the application process for graduate schools because, I mean, in that would make it tougher. Like you would almost want I say more diverse type of student in like chiropractic that can not only be a good test taker but also be able to touch people
Yeah.
like confidently.
Careful.
Let me rephrase that.
Yeah.
To be able to manipulate or use their hands appropriately. Maybe that sounds worse. I don't know. But you know what I'm saying. So, but in PT school, it's not like that. Like they're taking the smartest kids because they want the institutions to have these ridiculous, not only like passing rates, but also like not only within the institution, but within the board exams. So it's like, it's wild when you think about it that way.
And
Yeah.
even in chiro, the teaching to the board exams is a little archaic because
Sure.
chiropractic
sure.
can be pretty controversial. You know,
Totally, sure.
it used to be very bone out of place.
Yeah.
We put bones back into
Yeah.
place. That's obviously not how it is. Research
Yeah.
has proven that. But they teach a little bit to those board exams,
For sure.
or to that archaic type of way
Yeah.
of thinking. So even when I got out into the field, I was like, oh, I passed my board exams, I'm ready. And I'm sure getting out
Yeah.
into the real world, that's not
Not.
how it
Yeah.
is.
And
It's
that would
way
happen
different.
with anything,
Totally,
just
yeah.
with any kind of that would happen regardless, where they need to teach you like towards some kind of standardized assessment anyway. So yeah, but it sounds like chiropractic has that a little bit better balance than PT schools in that regard.
Yeah. Now I'm kind of interested, now that you're talking about it, I'm interested to hear your interpretation of like how the profession has evolved, like whether it's been like within the last 5 years or 10 years or 15 or whatever, or even ever since you've graduated. You know what I mean? Have you seen this shift within how these chiropractors are treating, or like you were just saying, there was this like model, but now there's this other model that we're kind of, utilizing?
I always tell my patients, because usually two types of patients walk into my office, whether I've never had a chiropractor before, you're my last resort, I need some help, or I've been to a chiropractor before, I know what the deal is. And I say, listen, well, you go to 10 different chiropractors, you can get 10 different types
1,000%.
of approaches. Same with PT.
Yep. Same.
You get chiropractors who only adjust C1, C2. You have chiropractors that don't touch you, which weird. So I feel like everyone needs a chiropractor in their life, but I may not be everyone's
That's right.
chiropractor. So you have to obviously know your why. You have to know and be confident in your treatment style. So I've evolved with that pediatric and pregnancy. There's a lot of research coming out about it, and I'm a little bit more research like detailed. So I appreciate that part, and they're throwing money into that type of research, which I appreciate. But going in and out of school, it's, I thought bone out of place, like push things back into rotation and this and that.
Yeah.
No, I just induce motion and turn down the nervous system. I'm
Yeah.
very nervous system, very
Totally.
neurologic based.
Yeah.
And you have to be with babies because they
Totally.
can't tell you my back hurts.
It's all
Yeah.
nervous system.
Or my
Yeah,
neck hurts.
exactly.
That's
yeah.
right.
Yeah, that's
So
right.
it's all touch and feel, and it's hard to do research on that.
Yeah,
But
for
the
sure.
research has gotten better with holistic care, and same with
Sure.
PT too.
Sure.
So-
Totally. 1,000%.
I've seen it. It should be better, but it has gotten better.
I think we
since
can
I've
both agree
graduated.
that every profession could probably be a little bit better
Yeah,
with
for sure.
no matter what you're looking at, right?
Yeah.
But and you're always going to have your pioneers, but then you're always going to have your people that are just kind of like, it's a job, so I'm just going to keep doing what I've been doing for the past 20 years. And it is what it is. That's just what it is. But in terms of like the field of chiropractic, now that you've seen it evolve, like what's your vision for chiropractic, or what? Maybe not the vision of chiropractic, but maybe how do you see the field of chiropractic moving?
Yeah. We have a workshop that we do for our patients. So I always tell people in my workshop, me, Riley Fake, in this macrocosm of a universe, my goal is to change how people see chiropractic and use chiropractic. Go from a pain-fearing mentality to a pleasure-seeking mentality. Since I got into this profession, not because my chiropractor saved my life because my back was hurt or, recovered me from an injury, like I assume a lot of PTs probably have experienced, I was feeling good. Chiropractic made me feel better. And I go, whoa, like that's cool. Like even
Yeah.
people who feel good, you can feel better. Trust me, I'm going to
Totally.
show you. So that's what I try to emphasize to people, because people are like, well, I don't have any back pain. It's like, okay, well, do you have digestive issues? Do you have migraines? Is your proprioception off? Like the people that leave
Sure.
the grocery store cart in the middle of the aisle and they have no idea. I'd be like, you're subluxated.
Yeah,
You need
yeah.
some more proprioception.
Yeah, for sure.
So that's my take with chiropractic. That's how I talk to my patients. I say, listen, we're going to get you out of pain first. That's first and foremost. But once you get feeling good, it's going to be great for you to feel better. Let's optimize you at that point. You're going to notice your anxiety may go down. You may sleep a little bit better. You may have a bowel movement every day.
Sure.
Like,
Sure.
little things like that people don't focus on when they're in pain. They're just
Totally.
like, oh, fix my back pain, fix my sciatica, fix my headache. It's like, okay, I can do that, but then I'm going to show you more. So that's how I approach chiropractic. And with the babies, like I said, you can't you can diagnose things on them, but you just have to help them. You just have to raise a healthy child rather than fix a broken adult. So I have to come at it not from like, oh, see this test, they failed this test, like that means they have back pain. It's like, no, I have to just feel, and we just talk lifestyle.
Yeah.
So
I
that's
love-
how I approach
Love
chiropractic.
that.
Do you get a lot of parents that they start to have all these like second thoughts about like, oh my gosh, I was doing something wrong and that kind of stuff, and then they're starting to feel bad, and you're like, oh, hold on, and then you got to
Yes.
shift the focus to them a little bit.
I always have to try to emphasize that you're doing a good job. Like you never judge a parent, even if I have my opinions. I see parents at their most stressed out. Their kid's not sleeping. Their kid's not eating. Their kid's not gaining weight. They're not hitting milestones. Their kid's behind. So these parents are stressed. And I just have to say, listen, like you're doing a good job. You brought them here. What parent is going to like think
Yeah.
the first thought to bring them to the chiropractor? Like
Yeah.
that's awesome that you
Yeah.
did that. So yes, part of it is like parent empowering and,
Yeah.
guiding them, but you don't tell a parent they're wrong.
No,
Sure.
Unless
absolutely.
obviously safety
Absolutely.
is in
Right.
question, but
Yeah.
no.
Yeah,
so I do
absolutely.
get some parents that will doubt. They're tired. They're exhausted. They say stuff they don't mean. And I go, it's fine. You're doing a good job.
Yeah.
Let's get you on the table next.
Well, that's what I'm saying. And that's the big thing. Like,
Yeah.
like being a parent now for 18 months, a lot of times I see when I'm stressed, even if I'm not outwardly stressed, like I can see changes in Theo because he senses it, right? Like he's like, oh, something's wrong with dad, and then like his nervous system starts getting off kilter. So I always wonder about that with when you're working with the babies, how much of the session is actually for the parent, right? Like
Yes.
it's definitely happening. We have a lot of that with we see a lot of high school athletes here. And sometimes like a whole session is for the parent. Like we have the athlete who's just kind of like nonchalant. They're doing fine.
Yeah.
And the mom's like, wait, should they be doing that? I'm like, yeah, mom, you got like, if you keep doing that, they're going to start stressing out about every ache and pain they have. Right. So we're just trying to, almost de-educate the parent in that context where the kid, it's like, hey, go jump over there. I'm gonna talk to mom for a second, So it's a very real thing, and it's only magnified with babies, obviously, right?
And parents put their kids first, obviously. You both know that.
For sure.
So a lot of times I'll see the kid first.
Yeah, of
and
course.
then, I really have to try to get the parents. And then you get to a family of 5, that
Yeah.
are all under
Absolutely.
care.
Yeah.
That's obviously the goal.
Yeah.
But usually mom will bring baby in first. And then I go, well, you need something, mom.
Yeah.
You need to de-stress. You need to
Totally.
sleep better because you're not going to be able to raise a healthy child if you're not healthy yourself. So
I like that. That was a good analogy. Raise a healthy child, not fix a broken adult. Did you
that
say
is,
broken adult?
yes,
Yeah.
broken adult.
Yeah, I like it.
Easier to raise
gotta
a
be
healthier
easier.
child than
gotta be-
fix
Yes,
a
sir.
broken
We
It's
adult.
also going to save a ton of money.
We gotta start doing pediatrics. So what you're saying is we're adding pediatrics.
Yes.
Pediatric
That's what I'm
PT man.
saying.
I
Yeah.
think
That's what
there's
I'm
something
saying.
for
It's
that.
true. I
Mhm.
No, I like it.
because we're getting on most of the adults that are like, man, we got
For
lots to
sure.
work on.
Oh, no doubt.
Yeah.
If you could just hit it earlier.
Yeah, for sure.
And do you guys get the question that I got this question today? Actually, a patient was like, "Now, is this ever going to go away?"
Oh, you would get that
All the time.
Right?
All the
And
time.
I don't want to say like, "No, it's never going to go away."
Right.
But I just think back to when you said you got in a car accident when you were like 14, 16.
Yeah.
That's
with you
You're going to
forever.
have a
Yeah.
subluxation, and sometimes I hate saying that because it is
Totally.
one of those archaic terms. I
Yeah.
get that, but it's very easy for
Yeah.
people. Like you have a subluxation with a trauma or a postural issue, then you just pile motor patterns on top of that.
Totally.
You're an onion. You have to like
Yes.
get all the way down there. So a lot of people will be like, "Oh my God, is this ever going to go away?" And
Yeah.
I'm like, I don't know, but we're sure as heck going to try to
Yeah, absolutely.
make it not be a problem.
Yeah. No, we get that a lot with I mean, we're seeing a good amount of middle-aged, older adults, so they have a long history, right? Like high school athletes, much shorter history, but when we got that long history, it's always that conversation of trying to make them or just help them understand like it all matters, right? Like your brain remembers, even if you're not consciously aware of something that happened as a child. Your body's still holding on to that to some extent. So, working through that stuff, it's hard for people to to kind of grapple with that. Like, no, I was past that. Like, it didn't even hurt when that happened. It's like, yeah, but your brain perceived an issue with that, right? So,
Yeah.
we have that conversation quite a bit, for sure. And I probably talk too much about it with patients. You can ask Chad. They'll be like, "Is Nick still back there with them? They haven't done anything yet. They're just talking." Yeah.
Nick, there needs to be a time cap on this boy.
But sometimes people need that though too.
No, they do.
I know.
They
yeah,
do.
100%.
No doubt.
But that's why we're In8 Wellness Center. So we do the chiropractic care. We do some of the corrective exercise on a very smaller scale. And then we do a blood chemistry analysis. So we have a phlebotomist that comes in and we do lifestyle panels
That's really
on all of
cool.
our patients. Not just cholesterol, blood sugar, A1C, but liver tests, kidney tests,
Yeah.
vitamins, minerals,
Great.
all that good stuff. And then we do have a gym connected to our office too
Oh,
with massage therapy and
Yep.
all that
I
good
know. I
stuff.
saw that. You definitely are a wellness center for sure. You've got it all in there, which is great. No, that's
So
awesome.
do all you guys are you all trained in evaluating the blood test too? Okay, cool.
Yes.
That's
Dr. Ryan
that's always
is
a tricky
formally trained in it.
Got you.
Apex Centers.
Yep.
I follow them on
Yeah.
Instagram. They're really good. I've learned a lot from him. And he's still so much to learn. But with trends,
there's
but
so much. Yeah.
most people have the same amount of trends.
Oh yeah.
So I do tend to talk about the
True.
same thing.
Once
as far as-
once you find the trends, you're like, okay, cool,
Mhm.
we got this.
And we'll do genetic tests with those blood work
Oh, nice.
Nice.
panels as well. We do MTHFR,
Yep.
Nice.
ApoE.
Yep.
The
You know,
motherfucker gene?
Yeah,
Yeah,
I
it's mostly
think
true.
you said it. You said it.
Yeah,
You
he
say
swear-
that. Oh,
Yes,
by
you
the way,
can
you can
swear
swear
on
on this
He
podcast.
swears all the time.
Oh yeah, you can swear on this podcast.
Oh, okay, cool.
By the way, I've heard Nick talk about that many times.
Yeah.
But the patient's like looking at it, and I'm
Yeah.
like, it's the motherfucker gene.
Yeah.
You're like,
Yeah,
oh.
it's like just call it what it is.
That's what it is.
Yeah.
Oh, that's awesome.
Yeah,
No,
and the genetic stuff is always interesting because everyone's always like, oh my gosh, I'm doomed. It's like, no, you're not. Something's got to turn the gene on. You can
Exactly.
always tone that down, or do things in life to reduce the likelihood of that manifesting itself.
Yeah,
and
absolutely.
that's a hard thing for people just like rack the brain around. It's like,
Yeah.
okay,
They get stuck.
I get it, but I still have it, and it's like, yes, I know you still have it, but again, on switch, off switch,
Yeah.
light dimmer, that type of thing. So
Sometimes those lifestyle panels are hard when someone's on a statin for 10, 15 years, or they're on birth control for their entire life, So it's part of me, I always tell patients, I go, this could be more informative. Like, our goal isn't to get you off meds. That's not my expertise whatsoever.
yeah.
But I'm going to say, hey, listen, you've been on a statin for 20 years. That's why your blood sugar may be a little messed up. I don't know. Who knows? But there are certain trends with that too that we try to stay up on.
So a little rabbit hole. Let's see. You mentioned it, so we got to talk about it now. So the birth control thing. If you're seeing a lot of moms and kids, are you seeing things manifest themselves from that, where mom was on birth control for numerous years prior to having children?
Yeah. Going through personal experience myself too. It's really wild the transition I've seen women go through to get off birth control, but then also on as well.
Yeah.
I've seen a lot of low back pain directly related to IUD. Like insertion.
Totally.
And I'm looking at someone's back. I'm like, why isn't this getting better? Like, this should really be good by now.
Yeah.
Next thing you know, they started care 6 months ago. They're like, oh, I got an IUD.
Let me
Like,
tell you this.
So it's like,
I'm sure
It's not the first thing that they think of.
Yeah,
your
of course
brain
not.
your brain views that as a trauma, probably, right? Like,
Exactly.
Sure.
Yeah.
Epidural pain with birth.
Yeah.
I've had women who have had to get IVF to get pregnant. All of a sudden they're under chiropractic care for like a year or two. They get a menstrual cycle out of
Oh
nowhere.
wow, yeah.
Now I have one mom of 3, and
Absolutely.
she's like, I have to be careful now. I don't want another one. I'm like, yeah. So it's wild over the longevity of the chiropractic care too, having that hormone balance or that response.
Totally.
I've definitely seen that.
You see any trends in the blood work with that type of stuff too?
Yes. Yeah. With the birth control, you'll see, because we do a hormone panel for men and women too.
Yeah, so you'll see,
Obviously, if someone's on, even if they told me or whether they didn't, all levels are just so
Of
low and
course.
shut down.
Of course.
Like it's almost like they have nothing.
You can't beat that. That's a lie detector test. You can't beat it.
Yeah.
Yeah.
So a 20-year-old, I'm like, progesterone. Oh my God, they're like low, and usually they're not low, because usually PCOS, endometriosis, they are estrogen dominant.
Yeah. Sure.
So usually we'll see a lot of issues with that. But yep, they're just shut down, and they're like, what about my hormones? Because everyone's curious about it, and I'm like, well, you take a birth control. That's I can't assess your hormones, and people kind of get pissed, and I'm just like, that's not me. Like, that's you.
Yeah.
This is always a tricky topic for like me to discuss with some of our patients, clients, because obviously I'm a male, and I've wouldn't be able to talk from personal experience, but birth control does put the body in a situation where it's more prone to fungal overgrowth, yeast. That's a common thing. A lot of women on birth control, they get diagnosed with yeast infections, but that yeast can then be passed on to baby, and then baby can deal with issues because yeast will, they basically, when they're active and then overactive, they're going to release aldehydes in the body, and then that can get through the blood-brain barrier. That can cause things like ADHD, stuff like that, right? So now we're seeing how like the connection there. So that's just like where you're stepping in and be like, I got to talk about this with this mom, but we'll start slow. We'll start here, right? And then build
we'll start
up
with
to
your
it.
concerns
But
first.
it's a tough, and like I said, it's a tough place for me to be in, because I'm like, man, this might be related to that, but we got to find a way to talk, because I've had that conversation where, see a mom, past the they don't want any more kids, but they're still having cycles. So they're on birth control, and it's like, there's still that, that kind of interplay there going on that could be manifesting itself.
But lean into that, because I feel like you have Theo, like you have experience with it.
For sure,
so
absolutely.
lean into that a little bit. Sometimes I feel like I have imposter syndrome. I've never been pregnant. I have no kids. But obviously I try to stay up to date, and people don't kind of challenge me on those things, but lean into that. I mean, I feel like you should give yourself more credit.
I definitely
than,
do talk about it, but it's always like, man, should I be talking about this right now?
Yeah.
But yeah, for sure. Cause same thing. I see a lot of postmenopausal women, and I'll talk about, okay, yeah, we need to support your adrenals. Like, your adrenals have taken over what the ovaries used to do. Okay, those are now being taxed. So that's a big conversation with a lot of because we have a good amount of postmenopausal women as training clients, and that's a big conversation about them. It's like, hey,
I love that you
your
talk about
adrenals need
that,
some
though. That's
support.
cool.
Dude,
Yeah.
this is a good segue into like talking about like the vision of chiropractic, because this is our vision of physical therapy and creating like this overall sense of wellness. Like people don't just come, like this is my big tagline. It's like, if you're going to a physical therapist and you're only getting physical therapy, you're not getting your money's worth. It's not optimal, right? Like for people to come here and yes, can we treat your shoulder pain? But yes, we can also talk about your nutrition. We can talk about your sleep, and we can talk about all this other stuff, right? Functional, like Nick's huge into functional health. So it's like, it really is like this overall wellness, but can be contributing to whatever's going on in your life. You know what I mean? And I think if you're not addressing these other big factors, then you're missing the boat.
Yeah.
You know what I mean?
100%.
And it's, yes, we can make your shoulder pain better. Will it come back? Probably, if we don't address these other factors that you're dealing with. You know what I mean? Like you were saying. So I think that is my vision. And it kind of almost seems like that's your vision as well, as to like creating this overall like kind of like whole health approach to like treating somebody, not just because of their shoulder pain.
Correct me if I'm wrong, but chiro, like this is one of the reasons I've always been I've had a high respect for chiro. Is that's kind of how chiro started, right? Like chiro started more as the holistic, like that's why they're often viewed as the kooks, so to speak, because it started as this alternative medicine before that was even really a thing. Well, actually, I shouldn't say before it was a thing, because it used to all be alternative medicine, but then pharmaceutical industry came in, and then chiropractic was like, no, this ain't it. We got to do something else, right? So so then pharmaceuticals were like, yeah, these chiros, they're crazy. But I respect chiro for that. But do you feel like it's gotten at a time there, it kind of got away from that a little bit? And
yeah, definitely. Well, in school too, like, treating to the board or going to the boards, they're like, you got to stay in your lane. You don't talk about, you stay on chiro, you stay bone out of place, you stay in your lane. Don't go too far here. Don't go too far there. You'll piss people off. And back with what Chad was saying too is like, go to your health coach. Like you guys are health coaches.
No doubt.
And that's what I view myself as too.
Yes.
What person can you go to on a weekly, minimum monthly basis where you can get a service and get coached on your overall health and wellness and being?
Totally.
You can't go to your primary once a month.
No.
Like you can't go even to your massage therapist once a month. Like you go to your healthcare provider and let you help them, me help you, all that type of stuff. But yeah, chiro, it was shaky there for a while. I've still gotten called a quack. Is what they would say. Like, I had this older gentleman in here. He's like, "You all are quacks." I'm like, "Okay, why are you here?" But anyway, you clearly need some help.
We're obviously not a good fit for you.
No, and that's the cool part about being the out of network. We don't have to accept you as a patient.
That's right. Yeah.
And we even say that in our new patient exam. We will say, if we decide to accept you as a patient and you are under care here, and people are kind of like,
"Whoa,
yeah." Is it application? So I'm like, yeah, we don't
try right now.
Yeah. So
that's awesome.
That's what I always tell people too. I go, you come to me once a week. Like, talk to me about things other than chiro. Like, how you sleeping, how you eating, all that type of stuff.
Absolutely.
Yeah. What's your mental state look like? Most of the time, I can tell when I touch people too.
Oh yeah.
I'll be like, hey, how's it going? They're like, oh, that's great. I'm great. And they lay on the table. I'm like, you are not great. Next thing you know, they're crying into the paper, and I'm like, okay.
A lot of times our questions are guided by what we're seeing, like what we're observing. Right?
Totally.
Like,
exactly. Yeah.
And these patients, they see, like you said, they see you like once a week. They see you once a month, maybe every other week, maybe a couple times a week. It all depends on the situation, right? But you're developing this type of rapport with this patient that not many healthcare providers can develop, right? Because number one, of time, but number two, like let's just face it, we all just care too much, right? So like you go to your primary care, they've got like 40, 50, 60 patients to see in that one day. They don't have time to care for you. I'm sorry to say it. That's the truth. But we do. You know what I mean? In this model that we have, like you guys have, like where we have this time blocked out for you specifically, gives us the amount of time that we need to address all of these issues, not 15-minute treats. It just can't happen. It's impossible. It's not. And that's why it fails.
And I would actually venture that if you did have the ability, with the exception of like some concierge practices, but if you did actually see your PCP monthly, like for a year, you would probably get diagnosed with something that you don't actually have or wasn't actually an issue, right?
Mm-hmm.
Like that would probably happen if they're seeing you that many times. They're like, you know what? We could probably give a med for this, or we could probably do this procedure, right? Like it's borderline, right? Like they almost fabricate something, which is like, it's terrible because it's not necessarily like that person is like that doctor's out to get you or something. It's
Right.
just the nature of how they're trained. It's
Yep.
like
They wanna
yeah,
make money.
Yeah,
That's right.
Yep. If
Sorry.
everything's
Yeah.
good,
Yeah.
if everything looks good, send them away for a year. And if it does, so if they're seeing you more frequently, you're like, man, something's got to be up. So you start making stuff up in your head. So
Yeah, we always say it's like
Yeah.
we try to. Well, Nick loves to give the benefit of the doubt. I tend to. We're like good cop, bad cop. So
Yeah.
I'm just like, nah, they're all stupid. Nick's like, well, hold on. Let's talk
Hey,
about
hey,
this for a
hey,
second.
hey.
So, but there's
Whoa.
one thing that I do agree with Nick about, and it's saying that like there's either two reasons why you're not getting what you need at a primary care's office, and it's either they either don't have the time, like so. I guess we could blame it on that, or they really just don't fucking know.
They don't know.
you know what I mean? Like,
And I've said it time and time again. It's
Yeah.
like, if it's that they don't know, yes, that's shame on them. But
Absolutely.
at the same time, like they don't know because they're trained a certain way.
That's right.
And they're being given so many patients every day
That's what
that
I
they
mean.
don't even have freaking time
Yeah.
for that.
And it's
Totally.
not in musculoskeletal health. Like,
yeah.
so I could be a little bit off with this statistic, but most Americans, the leading cause of disability, the reason why Americans aren't going to work is because they have back pain.
Totally. I would agree with that 1,000%.
What? So you mean
Yeah.
to tell me this is why Americans can't work, but our medical professionals can't diagnose and treat back pain, but they'll cancer, heart disease, diabetes. We got you. But people are going to the primary. My knee hurts, my back hurts. I
Yeah,
can't sit at work.
But
like,
they'll
"Oh."
stick their finger up your bum for a prostate exam.
Like it's so they're not trained.
Bend over for me.
They're not trained in musculoskeletal
Yeah.
health.
No, totally. I agree. I 1,000% agree. Like we have this conversation so many times with our post-op patients that come in. We don't see as many as we used to just because of the model that we're in, but we still do see them. And when we see them, it's like we always have to have this conversation with them, being like, hey, listen, we understand that the doctor said this, but listen, the doctor did his job. Let us do ours now. You know what I mean? Like the doctors do understand how to fix your problem, but now let us tell you how we can take it from here. You know what I mean? Doctors are not here watching you do your rehab. They don't know the process. You know, maybe some do or have an idea,
Yeah,
but the
some-
majority don't.
Yeah.
They don't.
And
you know?
everybody is different.
Totally.
We have a medical model that is just a one size fits all. And I know Nick can probably relate to this a little bit. So my sister is severely autistic, special needs, nonverbal. She is a victim of the medical system. I am fully convinced of this. She was given one thing, and she's not a neurotypical person. And she is giving dosages of medications and therapies that are for the regular developing person. For
Sure.
example, birth control.
Yeah.
There is no reason as to why my sister should have been on birth control. It's more for everybody else to know when her cycle is, when
Sure,
she's,
sure.
just so she can be taken care of. But she was on, I think, 14 medications. Okay. And not a slight to my parents at all. Like they had no idea back in the 90s.
absolutely.
She had
Sure.
behavioral issues. They're like, here's a behavioral med. She cooled right down. They're like, oh my God, this is the greatest thing ever.
Absolutely.
Fast forward 10, 15 years. She's epileptic. She is on 4 seizure medications. I had to have a talk with my mom. I go, Mom, 1 + 1 is not equaling 2.
Yeah.
You mean to tell me this child is on 4 seizure medications and is still having 20 to 30 seizures a day,
Whoa.
conscious and unconscious?
Yeah,
Wow,
yeah.
that's crazy.
Putting her through testing and this and that. And I go, Mom, what's the one medication that we know she should not be on? You and I both know this. She's like, the birth control. I was like, yes. She got off the birth control. What's it, March? She got off the birth control in September of 2023. She has had 2 seizures.
No way.
Wow.
Interesting.
That's crazy.
What's the correlation there?
That's crazy.
I don't know.
Well,
I'm just curious now.
metabolically, I'm not entirely sure. But
Sure.
what I'm confident in is she was given a medication for a neurotypical person. And for someone like her who does not handle hormones, medication, anything typically, and there are all those side effects to birth control, not to mention you add 10
totally.
other meds
Yeah.
on top of that.
Yeah.
Nobody knows how those meds are
How
going to
would
interact.
I was just going to say
Her
how they're
brain was
interacting.
literally short wiring. Like it was literally
Yeah.
fusing out. It
Yeah.
had no
Totally.
idea what to do with her body.
Yeah.
So we removed the birth
That's
control and
crazy.
she's now down from 14 meds to about 7, like
That's
about
amazing.
half.
Yeah,
That's awesome.
And she's
Yeah.
crushing it.
that's great.
But I go, Mom, like I know
Yeah.
it's not my field, but you gotta
Totally.
push these doctors.
Yeah.
Ask the questions.
Yeah.
That's all you got to do. Call me
Yeah.
conspiracy theorist, but those people ask
No,
questions.
you're not. And I would say that that's even changing now. I feel
Yeah.
like as the generations kind of go through it, and my mom's the same way, my dad's the same way. Like if the doctor says do this, they do this. Like, doctor's God.
Your mom's getting better though.
She is getting
Yeah,
better,
she's getting
but
better.
thanks to you though,
Yeah.
because
Oh, nice.
so
Much
my
better.
mom trains with Nick once every. So my mom's had
Yeah.
2
Yeah.
like hip replacements, and Nick takes care of her in many ways, like in terms of like the rehab
Oh, yeah,
aspect,
we-
but also like
Yeah.
her medications and her
Yeah.
functional health, if you will. So like she sees a cardiologist in Missouri that's out of network that I brought her to, because like we can't trust I can't trust anybody. Like, they kept on just giving her more medication. I'm like, Mom, this is not the answer. They're treating symptoms. It's making you worse. And finally, so now she's at the point where she is dropping medications as well. So it's like, it's good to
That's so
see that.
cool.
You know what I mean?
Yeah,
And like,
for sure.
how many friends that she had? Like, she's had like 4 or 5 friends this year that have already died
I
from
know.
some sort of
It's-
cardiovascular
it's
event. It's like,
crazy.
look at the trend. This is
Yeah.
not like,
Yeah.
Yeah, it's not.
Not
And most of the
typical.
time they look and in the state that they are in, they see their friends passing away. They see their
yeah,
and it's kind of crumbling around them, and they're like, "Oh my God, now I
Yeah.
got to do something."
totally.
Then they come to us, and we're like, "Whoa,
Yeah.
okay, we
Yeah.
will do our best." But sometimes even the little that we do will help them tremendously, and even though they're getting pushed medications and this therapy, and even sometimes a little dose of a supplement or one little
Yeah,
exercise,
absolutely.
or
Yeah.
it'd be like life changing
Yeah.
for them. One adjustment
Yeah.
could be life changing for somebody,
Yeah.
and it's the coolest thing.
Yeah, or even like we get a lot of people that they come in with their med list and they're on a statin. It's like, just asking the question, did your doctor prescribe you some CoQ10 along with that? Because statins deplete that. And they're like, oh no, I don't even know what that is. It's like, you should probably take that because your statin's depleting it. So I'm not going to tell you to get off the statin,
Hmm.
but you should probably take that in if you're gonna be on the statin. So that type of stuff that these doctors aren't even telling them that piece of it, where it's like, yeah, this severely depletes that, which is hurting your heart in the long
which
run.
also depletes other things.
Oh, yeah, yeah.
Hormones,
Yep.
like, right? So it's like,
yeah.
people are feeling worse that they're on the statins. Maybe their levels are improving, but they're like having some
Yeah.
sort of depression or anxiety or whatever it may be. It's like, yeah, because there's, you fix one problem, but you caused another.
Yeah, you're just
You
gonna
know
get
what I
another med for that. You're
Yeah,
gonna
exactly.
get
That's what I mean.
med,
There's an
yeah,
app
And
for
that's-
that. You need a med for that.
That's right.
Yeah.
It just becomes a domino effect.
Yeah, for sure.
And the cool part about just the one question that I will ask my patients to tell them to ask their doctor, I go, what's the end game with it? Okay, you're a 37-year-old male who's a little overweight. I wouldn't even say like obese. Like, you can fix this. You get recommended a statin. I go, so how long are you on that statin for? And they just look at me.
Forever.
And they're like, I
Yeah.
don't know. I go, well, did you ask? And I don't mean that to be an asshole, but like, I
Yeah,
go, well,
yeah,
did you
yeah, yeah,
ask?
yeah.
Like, if someone told me I need to take an antibiotic or a med,
All right, cool.
well, how
Yeah.
long do I take it for,
Yeah.
Doc?
3
they
days,
should-
5 days, 7 days. Yeah,
They
yeah,
should be able to tell you.
Yeah.
Till your levels go back down. We'll check you next year. It's like,
yeah, I know. My favorite
no.
one for that is the proton pump inhibitors like omeprazole. It literally says when you open up the insert, no one looks at the insert, but if you look at the insert, it's a lot of small
Nick
writing.
does.
Yeah.
The first one.
Nick reads it.
Well, because I had to actually
We're
like,
going to get to that
show-
point soon,
show-
Riley. Don't worry.
I had to show people the insert and be like, look at this. Like, you've been on this for 10 years and it says this med should not be taken more than 10 to 14 days. Like, they're on
no,
for
it
like
does
10
say that.
years.
It's wild. Yeah.
And it's, if you look at most meds, they say a short time frame,
Mhm. But you are not given time frame on those meds.
Oh, never. Yeah, you got to look at that exit strategy for sure.
And that's why you bring up a good point. Like, all of these patients have to be advocates for themselves, because you can't just take everybody's word for it, So I think that's a great point. All right, I want to talk a little bit more about like In8 Wellness.
Oh, yes. Yes.
Because
Let's do it.
because it's an interesting. I like the model that you guys have over there. It obviously jives with the model that we have here. I love the fact that you guys are out of network. Were you guys always out of network? Was that something that just happened, or
Nope.
like how does that?
We
Yeah.
were always out of network. Dr. Ryan Hewitt, who he was a mentor of Dr. Stephen Franson, who owned the office in Beverly. That's where he was mentored. That's where he
okay.
started. To my knowledge, Dr. Franson has always been out of network. And then Dr. Ryan came and opened up the North Andover office. He's been there for about 10 to 13 years, I do believe. And he has never messed with it.
Yeah, I love it.
It's so cool.
Have
Yeah.
you been there ever
That's
since you graduated?
No, I was at 2 other offices. The first office being very insurance.
Sure.
Insurance means I didn't know the difference. I didn't even know
Yeah.
people paid out of pocket for their health care.
Yeah.
Well,
Like,
yeah.
no idea. That's
people
not what you're
don't,
taught,
Hey,
right?
you don't get taught that.
So that was my first experience. COVID happened and I got furloughed because it was a franchise company and I was a multiple chiro office. I was the new guy, so I got furloughed. They couldn't guarantee me full time, so I went to another office that was a hybrid. And they did cupping, dry needling. It was like PT and chiro meshed together, but
Yeah.
people paid out of pocket for it.
Sure.
They were paying money.
Yeah. Yeah.
And I was like,
Man.
okay, I think they may be onto something here. I was like, okay, that's pretty sick.
Yeah.
I was working way too hard and way too long there. I was like, I don't need to work that hard. So found In8 Wellness, and it scared me a little bit because Dr. Ryan was like, well, listen, I'm going to have my patients You need to build your own. So not an independent contractor, but he has his patient load. I have my patient load. So I had to get good at business, which you are not taught. I don't know about you.
I will say this though, chiropractors definitely have. You guys have more business in school than we do. We've had this conversation with many people.
I had no business.
Really?
None.
Yeah, interesting. We didn't have any. Zero. I've had some chiropractors on here that have had some, but it's more than what we had. So that's interesting.
They taught me how to fill out an insurance form for an entire semester. I do know how to do that. I don't anymore. But he has always been out of network, and he goes, here's the framework. You do a day 1, day 2. You got to this is what you need. Yeah. $2,500. And I go, I have to ask people for money.
Yeah.
What? I don't even like asking my parents for money. So that was a learning curve for me, for sure. But it's so rewarding for someone to invest in you out of their own pocket. Yeah. That's cool. Then you have that person's trust, and then it's like a done deal after that.
And I feel you have more of an appreciation for it now because you've worked in insurance and then you've not worked for insurance. And we've had that same revelation. Like when we first opened, we were all insurance, and then we made that shift. And like you have a greater appreciation for what you do now versus for how it was. Number one, because of all the BS that you have to deal with, but also like you're actually getting value for what the service that you're providing. Like your value is worth way more. It's not worth what your insurance dictates. Like Blue Cross says I'm worth this much, but United Healthcare says I'm worth this much.
Blue Cross Blue Shield, I'm worth $13.
You guys don't talk. Why does Blue Cross think I'm worth more than you?
Yeah,
you know what I mean. And then Medicare is like up here. What is this?
Oh,
you know
really?
What I mean?
It's like backwards for me.
No, yeah,
Medicare and Mass Health, $7 for an adjustment.
Mass Health is not a great payer, but Medicare was our better payer.
Dang.
For PT, yeah,
that's wild.
Yeah.
So we love that aspect of it. We try to get every once in a while, like patients go under an intensive phase of care. So it's usually like 2 times a week, 3 times a week for like the first month or so. Then we transition them to corrective and maintenance care where they come less and less, hopefully. And when they sign up for like that initial package of care, that's when they're in pain. That's when they're desperate. That's usually more of like the easy sell.
Sure.
But to get them out of pain, now they're like, well, I'm better. Why do I need to keep coming? But I'm going to see if my insurance pays for these visits. And I'm like, oh man, like you feel good. Why not just keep paying to feel better? Back to my whole thing. Like you feel good now. Why not just keep staying? So we still struggle with our renewal stat, as you say, because we get people out of pain. They feel like they're good. And they want to see if they can get reimbursed for all this care that they paid for.
Can they not?
They can. Blue Cross Blue Shield's pretty good. There are a couple. The private pay insurances are good. But they won't pay for maintenance care. They won't pay for you to come once.
They never will. And they
just
never have.
2 adjustments for a year. They're not going to pay for that. What insurance company does? Maybe 20 at most.
Yeah.
I would go, you use that up in your first month. I'm so sorry. That's what we do here. But we're high volume. So I do feel like we're unique in the sense that, so on a long day, when I treat like 8 to 10 hours, I'll usually see about like 60 to 80 people. Wow. So we're high volume, but I still feel like we deliver very good care. And we alternate our schedule. I don't know how you guys do it here, but we have treatment blocks. Then we have consult blocks. So not that people can just like walk in. I mean, people are scheduled, but the adjustment block like for this morning was 7:30 to 8. I probably saw about 15, 20 people between 7:30 and 8. And then you have a consult block from 8:15 to 9. I'm blood consult, new patient, report, whatever. So we alternate a little bit. So we have blocks. So even if you're scheduled for 9, you can show up at 9:15. You'll still get adjusted. Type of thing. You'll jam up the schedule and piss me off. But just come when you're scheduled. We do have some people that will just walk in and I'm like,
we know how that feels. Yeah. We were there at one point for sure.
But that's the cool part about us is even though we are considered high volume, I don't think a lot of our patients feel that we are high volume. And that's a cool part that what we do. Because an adjustment takes 2 seconds. You know, so the other like 2.5, 3 minutes, I check in with the patient. It takes 2 seconds to deliver an adjustment. Okay, you're healing, you're doing well. What else is going on? Okay, on to the next. So, and our office is set up for those easy transitions.
Sure, gotcha. Yeah, when it can flow like that, and you have it to be efficient like that, it's like that was our claim to fame as well. Like people, it was like a well-oiled machine. You know what I mean?
Systems and processes, which I'm sure you've worked very hard for.
We have systems.
Yes,
for sure.
I've had people call me like a crook. I've had people call me like, you know, you're stealing, you're this, you're that. I'm going, okay, listen.
We've had it all too. Like,
But those people who pay you out of their own pocket, they're better compliance. All right. My compliance in a cash practice blows my insurance compliance out of the water, especially with my first office. We had a lot of PI, workers' comp.
Yeah. Oh,
Oh,
yeah.
Lord, yeah, they were horrible. So people pay you out of their own pocket, they're going to show up. So our compliance is never below like 88% in a week. That's our goal. Our stat is 88%. We're in the 90s easily for a high volume. So if each Dr. Ryan sees about 220 people a week, I see about 150, 160, and then we just added another doctor. So he's new. He's at like 20, 30 right now.
Yeah.
So we're seeing,
Yeah, that's wild.
300-400 people a week.
Yeah,
it's crazy. Yeah.
that's wild.
Yeah.
It is. Yeah.
We were seeing that a month when we were like the insurance game, remember? And that was a lot.
Yeah.
So, but no, I totally understand that, and it's I just love the fact that you guys offer all those type of services there. It's really, really cool.
Yeah. One-stop shop. We try.
Yeah, I think it's great. I would like to talk a little bit. I mean, since we're on the insurance topic, I love shit on insurance.
Let's do it.
Nick rolled his eyes.
Yeah, he does. He does.
Nick rolled his eyes.
I like talking all things health. Chad just like shitting on insurance.
Yeah, but you like shitting on things too.
Sometimes.
So we had a patient that came in, was like 2 weeks ago, 1 week ago, and she was like, you know what? You guys made the best move by going out of network with insurance. And we're like, why so? Yeah, it was Hayden's patient. And
very enlightening.
Yeah,
like for
I
this
said, well,
patient
thank you. I appreciate
Yeah.
that. And she goes, no, seriously. So she's a psychiatrist, I believe. And they just had this huge cyber attack on this. It's like this technology company that basically works with submitting claims through clearinghouses. I don't know if you heard about it yet.
No, I haven't.
We hadn't either because we don't have to deal with that.
Yeah.
But I have now since learned that it's more of a big deal than I had thought. So there's this company called Change Healthcare, and they were the target of a cyber attack. It was like literally a ransom cyber attack. It was this outside company called this group called Black Cat. Yeah, legit.
Wow.
Right? They infiltrated this insurance like technology based company and basically said, hey, we're taking your shit. If you want it back, it's going to cost you money. So they're like, what are we going to do? So they shut everything down. Nobody's getting paid. You can submit claims, but nobody's getting paid. So hospitals, your local dentist, your physical therapist, your chiropractors that are all taking insurance are all getting hit by this if they use this. So then they're all the major healthcare companies, including Medicare. So it's interesting. So with this company, Change Healthcare is also owned by United Health. Shocking.
Shocker.
Yeah. So United Healthcare actually sent these people $22 million to say, can you give us our stuff back? Isn't that crazy? So, but they've got all their money back, right? And they actually sent it. You know how they sent it? They sent it through Bitcoin. I looked this up. So one of my patients, you know who I'm talking about, he's big in the insurance game. And he was telling me this whole story. And I'm like, get out of here. He goes, they transferred like 350 Bitcoins, which is about $22 million to this random company group, that, infiltrated their shit. And I said, so what do you think about that? He goes, honestly, I think it was a bad move. He's like, I hate that people aren't getting paid. He's like, I'm not getting paid either. But he goes, now they're just a bigger target because they know people are just going to pay. So with all the AI and everything that's coming out now, he's like, dude, this is like a big deal. You know what I mean? So it really does.
Catfishing insurance companies.
Seriously. So this is the deal. Like, if this doesn't make you want to go out of network with insurance, I don't know what will, because not only are you getting shitty reimbursements, you decide whether or not you're going to get paid based on who you're seeing. You can't even do what you want in terms of treatments. But now they don't even have to pay you if they get fucked. So like, what is this? You know what I mean? So now people are just
hold
hoping.
on to it. Yeah.
Yeah, and there's no deadline. Like, nobody knows when they're getting paid. You know what I mean?
Wow.
I went to the dentist yesterday. I asked him. I said, hey, you guys having problems with this? Like, how did you know about that? I was like, I know everything. I was like, no, I heard about it. And I was just curious. And they were like, yep, it's a big deal. I'm like, damn, that sucks. So, yeah. So,
that's crazy.
That is crazy.
Yeah. So I felt like I had to mention it because it's kind of a big deal.
It is a big deal. Yeah,
but everybody that I'm, associated with that are not in the insurance game had no idea about it because why would we? We're not. Yeah.
Let me ask you a question. When you guys transitioned, because this only happened to me recently, so I started seeing patients for cash, and when the patient's trying to submit for their reimbursement, they would tell the patient, well, she's in network. And I'm like, I haven't been in network in 3 years. Like, what? To get out of network with insurance companies. I had no idea. You got to write a letter.
Oh, yeah.
You got to contact.
Did you have to do that?
Yes.
Yeah.
I would, and they had my very first office in the city of Boston. So when I moved out here in 2018.
Jeez.
And I was like, I haven't been there in 5 to 6 years. Like,
when you give them the super bill, are you putting your individual MPI on there, or are you putting your
I do believe
your
it's
business?
the group. It's the business.
Yeah, it's the group.
Yeah.
So it's surprising that they still caught that because it's the group MPI.
Yeah.
But if you have your individual on there too, that's where they'll nab it from. And the weird part about that is you're right. So not only do you have to write a letter, not only do you have to follow up with them every single week because nobody's going to do it. Some insurance companies, it's 60 days. Some it's 90. We had one that was 180 days. 6 months. Remember that? So I was like, wow, that really sucks.
Just kind of waiting, sitting there, like twiddling our thumbs.
So I'm almost concerned some of my patients are getting
so
reimbursed.
That's a common problem amongst people that want to start their own business or go from in-network to out-of-network, because you may not know this, but with some insurance companies, not only do you have to credential as a business, but you have to credential individually. So Blue Cross specifically does that, where you have to, like when Nick came on board, when I was here, like it was, yes, I have to credential Proform, but then I have to credential Chad. I have to credential Nick. So if Nick's like, hey, I want to go do my own thing, that's cool. But if you see people that are Blue Cross, you're going to get flagged too. And that's what happens. So nobody knows that. So if I terminate Proform, Nick has not been terminated. He's still an in-network provider.
So he still could.
Correct.
Wow.
Yeah, it's weird.
Sounds like it's really easy to commit fraud then, right?
Totally.
So
totally. It's bad.
They don't even make it foolproof to where even if you cut Proform, if Nick still wanted to see all these insurance patients and you're charging him cash, and he's like...
Funny story, actually. It's not funny because it really sucked when it happened. But when I left my previous job and opened up this business, I didn't know that. So what happened was when I was submitting claims, my claims were getting paid to my previous employer. I was like, you motherfuckers.
Wow.
So I had, and that was the clearinghouse that was doing that because everything was coming back. They thought it was me, but they saw that I was still associated with that previous employer. I was like, wow, this really sucks. So I had to fix that and get reimbursed. And it took like 6 months to get that off. That was before you even came on. Yeah, that was messed up. Yep. Really messed up.
It's crazy.
So
I didn't realize, like, I was like, oh, I just don't submit to them. People just pay me. It's a person-to-person transaction. I got nothing to do with this.
Totally.
And they were like, no. Like, we're not going to give your patient their money because you're still in network.
That's right.
I haven't submitted a claim in 5 years.
Yeah, they don't care. Which is kind of funny because you typically have to re-credential, and I'm surprised they wouldn't have terminated you automatically.
Well, the CAQH will still reach out to me. And I've had to call them and I'm like, listen, I'm not reattesting. Like nothing has changed.
That's interesting.
And they were like, okay, then just don't do it. And I was
That's
like,
right. Don't reattest.
And I was like, okay, I won't, but but my people need to get paid. I'm like, so what do I need to do here? It was a whole 2 months of
but you don't need to reattest for CAQH if you're going to be an out-of-network provider.
Yes, but they'll still email me. Or when I was having these issues, I was like, so maybe I go on the CAQH and I can de-attest or delete. I don't know.
It's every 3 months, so just wait till the 3 months goes and you're good to go.
Oh my God. Yeah. But Harvard Pilgrim was a big one. They kept coming out. United was a big one. Blue Cross Blue Shield didn't have any issues with them. It's almost like I didn't submit claims to them. They were like, okay, we're 2 years. We're not going to bother you anymore. Yeah. I just let my contract run out. But no one told me. But I also wasn't in business for myself. So Ryan didn't know this. Ryan was like, why the hell would I know how to do that? And it wasn't his fault. But my previous employers, when they just let me go or when I left, they were like, okay.
Yeah, they don't care. You know what I mean? Because what the next person has to do, because I had to do this, when we were in network, you have to get all of their previous information. For example, Medicare, I have to get all of the previous person's information in terms of their Medicare ID number so that I can actually transfer them to my facility because we are the ones that are getting paid, not the employee, but the employer. So it's quite the mess. And so nobody knows what their CAQH number is. Nobody knows what their Medicare ID number is. Most people don't even know what their Social Security number is. So it's
it's true.
You can't even get this number.
Yeah,
it's true.
So you call this other place, they're like, yeah, I don't know. We don't have that on file. It's like, how do you not have that on file? So now I have to call, have to have that person call. It's like, it's quite the
it is quite the
mess.
I didn't realize that, and that was when I first within a first year of me going cash, I started running into this, and I was like, what is going on? I didn't know you had to de-credential.
Yeah. You do. Yeah, it's pretty wild. I always tell people it's very easy to get in. It's even harder to get out.
Exactly. Yep. Well, you wonder what the reason for that is.
It's like a gang.
It's like they got you.
Totally a gang.
It is. It's a cult.
No doubt. If you can avoid going through the process at all, don't even bother. Don't even bother. Oh, that's wild. What do you think, Nick?
Dude,
what do you think about this situation?
Well, that whole conversation is the exact reason I'm not going anywhere.
It's all a lie. I just say it's a Nick won't leave.
No, it's you got me, dude. You got me. You had me. I don't know. Like, that just blows my mind, and I wouldn't want to deal with any of that. So, hey, I'm glad you deal with it.
It's such a mess. I hate dealing with it. But we don't really have to deal with it anymore.
Yeah, no,
so, I mean, you were talking about motor vehicles. Like, we actually just got paid on a motor vehicle accident that we treated somebody in 2017.
Woo!
Isn't that wild?
Yeah.
Yeah, and it
We got
was
paid
about a
way
third.
less than
It
we
was
were
about a
supposed to
third
get.
of what we were supposed to get.
I have a PIP case that's like 3 years running right now.
Yeah.
Like,
It's going to end when it ends, and that's the problem. You know what I mean? And then the attorney's going to call you and be like, "So, will you take this much?" Be like, "No, we want to take what we were billed." Well, I don't actually have that, so you're going to take what I give you.
Black cat took it. Yeah, can't give it to you. A black cat took it.
But nobody knows this.
No.
We don't have to do like an unfiltered, like insurance, like
oh,
unfiltered.
can I come on for that one?
Yes.
I will.
Yes.
Oh, we should get
Yeah.
Ryan on for that
Yes.
one.
Well, we could
Totally. That'd be sick. I'd be down for that.
quick unfiltered. You think that was an inside job? That whole black cat thing?
Listen, I'm not surprised by anything
Just to
anymore.
get a little conspiracy.
I am
don't know,
not surprised by anything anymore.
Yeah.
I'm really not. But honestly, like after this whole thing, like I wouldn't advise anybody to go through insurance unless you have to. You know? Yeah, it's nuts. All right, if we're done like talking about all this stuff, I want to talk about you.
I was wondering
So,
when we were going to get to this.
Yeah, we're about almost an hour in. So
you may be very disappointed. We were pretty boring as athletes,
no,
right?
no,
Right,
no,
Nick?
no, no.
Right,
Listen,
Nick?
That's right.
All right, I want to start with this is where I'm going to start. So I don't know if you remember.
I don't know what's coming.
Was this the first time you've seen Nick since college?
Probably.
Like in person? In person?
Probably.
Probably.
What was
Yes.
the first thing that you noticed about Nick when you saw him versus like say 6-7 years ago?
Wait, like right now?
Yeah.
Oh, like when I first walked in?
Yeah, you were like, oh, hey, Nick.
He's taller than I remember him.
You got taller? Okay.
Yeah. I mean, obviously, I
Yeah,
know his
you know,
wife, Alicia.
That
and
makes sense
Yeah.
because I was always around really tall people whenever you saw me.
That's true.
Okay. All right.
he wasn't the forward or the center. He was the shooting guard, so he wasn't.
Yeah, I was in the middle. I wasn't the tallest. I wasn't the
Yeah.
shortest.
So I'll answer the question for you. So when Nick came on, he was probably about 180 pounds soaking wet. This kid was tall, lanky, and all right. My first question, besides that,
We should
because
probably show
that
a
was more
picture.
just that was more
show
just
a
point.
picture on
I know
the
we
video.
should. I got that. We did the side by
Like the
side.
Tom Brady photo, like when
Yeah.
he first got picked in the draft.
Yeah, he's still just as fast. Actually, he's faster.
Yeah,
You'd
yeah.
probably be faster now.
I'd be faster now. I'd be faster, stronger. Man, I wish I could go back now.
Yeah, yeah. Seriously.
New
So,
model, baby. New model.
When you guys were in college, did you anybody ever bring like snacks to class or anything like that? Did Nick ever eat anything in class?
Well, he was in PT classes. I was in exercise
well,
science.
we would
didn't
have been
have
in
any.
like similar bio classes
Yeah.
and stuff early on. I don't know if I brought classes to those or snacks to those classes. I slept in a lot of those classes.
That would make sense. That would make sense.
A lot of people looked at me. They're like, "Why? How did you get an A? You slept the whole time." I'm
Yes,
like,
that
well,
was Nick.
I was up studying.
All right,
last-
that was going to be one of my other questions.
Well,
'cause-
so that was a big problem I had in college because I would stay up late studying. I did my best studying in the middle of the night, so I would barely sleep. So then I'd fall
Yeah.
asleep in class, and people would like. I used to sit next to the Riv, Colin Rivette,
Yeah.
and he was the most like
He-
aggressive note taker. Kid was writing the whole time, and it was just
I
like
do remember
insane.
him.
And I'd like
Yes.
lean over. I'd be like, "Hey man, what's going on?" You know? and then like I'd get a better grade on the test, and he'd get so mad.
He gets so mad.
Yeah.
So mad. And I was just like,
Interesting.
dude, I studied last night. I don't know what to tell you. I can't do it in class. Like, they're talking there. I get it. I'm just going to study the stuff. And he was just like, yeah, but I got all these notes. I'm like, yeah, but like, did the notes help? And he's just like, a little bit. I'm like, yeah, but they gave us the stuff we need to study, man. And it was just like this back and forth every time. But yeah, I had a really bad problem of falling asleep in class because I would stay up too late doing my studying. So I studied really hard, but I just did it at terrible hours.
So Nick, when he first started, he would eat peanut butter and jelly sandwiches every day. Every day. Sometimes he'd bring 2. And today...
That was when I started to try to gain muscle. I was
Yeah,
like,
yeah,
I got to
yeah.
up my PB&J too.
PB&J.
This is going to be the key right here.
So Nick
2
has
PB&J
made...
instead of 1.
the transformation, like this crazy transformation where like, what do you, well, like 215 maybe?
I'm
Ish.
hovering right around 215 right
So
now.
he's like 215 pounds
Nice.
now. The dude eats like
So I could tell you what I was.
liver and
'cause-
beef and testicles
'cause
all
we
day
have,
long.
yeah.
And
Dude, don't just say testicles. They're bull testicles, okay?
oh, sorry.
They're bigger?
I'm not eating. Yeah, man, they're from a cow, okay? A really strong, robust cow.
Yeah, right.
But so I remember because I think it was my junior year of college. I was an athlete, right? I was a collegiate athlete. They had the all the different things to measure body fat in the exercise science
They
department.
really
It's different.
prioritize the athletes. So
Did
if
they?
you were an
Yeah.
not
I
to
could
toot
see
our
that.
own horns,
Yeah.
if you were an
Yeah.
athlete at Springfield, you got treated like very, very well.
So I was
Yeah.
a junior year, which statistically was my best basketball performance year. Largely, if you ask me, it's because I had the easiest academic year. I was a nerd, so I studied really hard. Like I said, stayed up late. So if I had better sleep, better nutrition, I probably would have had more consistent basketball statistics, in my opinion. But nonetheless, because I had the least amount of that stuff junior year, it seemed to be my best basketball year. That year I was 180. I think I was listed on the roster as 185. Body fat measure 17%. I haven't been on the InBody in a while, but I'm 215 now.
You're definitely not 17%.
Yeah, 215.
Yeah.
If I had to guess right now, 12 to 13.
Yeah.
I was also
Yeah.
listed at 5'8" in the
Yeah.
program. So I mean,
Yeah, well, I was that was
qualified
that
me.
was what annoyed me. So I was listed accurately in the program. Me and Josh were both 6'3". We were listed accurately. Sean Martin is not 6'3".
stop. What was Sean Martin?
He was listed as 6'3", and he's maybe 6'1".
Maybe.
All right? Sean would probably never listen to this, but if you ever do, Sean, no, you're not 6'3", dude. You're 6'1". All right. So if that, I'd say 6 foot. All right.
Oh my
You're
God.
fast, but you're 6 feet tall. So yeah, the programs, like, they usually everything above or below in men's, everything above and below 6'3", they give them or take inches away. 6'3" is just always 6'3". It's like, that doesn't make any sense. I don't get it. Give me an extra. Make me 6'5". Give me 2 inches. Come on. They didn't want to give me 6'5", or at least 6'4". Come on. So yeah, I was 185, 17% body fat, and now 215, probably somewhere around 11 to 13
Yeah,
range.
I would say that's accurate.
Yeah,
That's
so
accurate.
different model. I
Yeah.
was a Prius then. I was just an electric, plug it in.
Oh, I
Well,
can't
all you
wait
had to do
I
was
can't
run
wait to hear
Prius.
what he's going to say
You
is
had to
now.
run 3-point line to 3-point line.
Now,
Yeah.
now I'm just a sleek Honda Odyssey.
Odyssey, I
minivan.
knew it. He was going to do the Odyssey.
Yeah, baby.
Can't
So,
even be a pickup truck.
I was the redheaded stepchild on the women's team. I was not the most desirable by my coach at all. I sent her, I almost think I gave her multiple aneurysms. Nick was,
Yeah.
Yeah, I was.
yeah,
I could see that.
Yeah.
Yeah.
I could see that.
Well, so like, and so Chad doesn't really know much about basketball. Okay?
No.
Okay.
So, but I was.
Don't get too technical on me.
No. I won't get technical, but I was a coach's son through and through. My dad played professionally.
Yeah.
My dad coached in college when I was growing up. My older brother, early on, didn't care about basketball. I literally would get home from school. My dad would come back from work to pick me up just to go to practice because I wanted to be around it. So I soaked it all in my entire life. So I was a high IQ. That was my greatest strength. High IQ.
You were a smart player.
I couldn't, I could play any position. Like Coach Brock had a rule too, where he didn't have guys play multiple positions. He's like, I want you to get good at this one position because I don't want you to have to go through your brain and know all these different, positions. Literally freshman year, he was like, wait, you know what, Robbie's supposed to be doing? You know what Pat's supposed to be doing right now? I'm like, yeah, coach, I got all 5. Like, I can tell you what everyone's supposed to be doing. And he's just like, all right, you okay playing 2 positions? I was like, I'll play all the
Yep.
positions, coach. So that's like my claim to fame is like, coach never played people at different positions. I played all 5 throughout my career. Like, I literally, the times I played center was because one time we had our 2 centers were suspended.
Yeah.
So they were doing things they weren't supposed to. We won't talk about that.
Nope.
And then the other times were like foul trouble. There was probably one time where it was like academic issues. But like most of the time it was like, yeah, they were either in trouble or foul trouble. It's like, all right, Nick's the only one who knows the position. You gotta go play it. Get my butt kicked by like some 6'8" guys. But like, so that was my strength. So in terms of playing time, I played a lot of minutes. In terms of like, scoring, things like that, yeah, like I played a lot more minutes than other players who scored a lot more than me, but I was always on the court for the most part. So yeah, like in terms of that, I played a lot. I
I did not play along.
The joke was that I was the face of the program.
Yes.
Yeah, I can
Yes.
see that.
And
I can see that.
so anytime they would be like, "Oh, we got to interview a basketball player," we'll just get
It was
we'll get
always
sync. We'll get sync.
It
We'll
was
get sync.
always Nick.
We got to follow. We got to follow. It was hilarious. They were like, "We're doing this thing where we're following athletes around for their day." And they're like, "Oh, we'll do sync," and it was hilarious because they joked about it afterwards. They were like, "It was Josh the entire time," because me and Josh lived together. So, and Josh, literally, like, Josh was the only one talking in the camera. Like, I was just kind of sitting there doing work, going through my day. Like, their cameras just on me. It's funny now because I love the camera, but like,
Yeah, he does.
then it was just like, I was just going through my day, super quiet, didn't really say much, and Josh was just yapping the whole time. They were like, "We should have just followed Josh." I don't know why I followed Nick. But,
So this validates pretty much everything that I was going to be asking you. So like Nick's a goody two shoe. He's the class
sure.
clown, but also the teacher's pet. So I think we figured it. We narrowed it down. Like that's pretty much like what we think here.
Yeah.
He hasn't really changed. He's still the face.
good.
He's still the face of Proform.
That's right. Chad owns Proform. I'm the face of Proform. It's just the way it is. It's just the way it is.
So I only have one additional question for you, and the question regarding Nick. So if you could describe in your own words, without looking at Nick, describe what comes to mind when you think about Nick in college. What would it be? Could be a word, could be a few words, could be a sentence, could be a paragraph. Doesn't really matter. But like, if you had to like say, yeah, if I had to pinpoint it, this is what Nick was in college.
Oh man, just in general.
Yeah, in general. I mean, it could be a word. It could be multiple words.
I don't even know what I'd say for that.
I would say. When I think of Nick, I just think of he's sweet. I know it's Alicia. I'm sorry.
Thank
No,
you.
just very.
That's so
No,
nice.
Nick was probably the most approachable person. I think you and I like connected like
Yeah, for
early on.
sure.
We were the same year,
For sure.
and he was a little bit more inviting. Him and
Sure.
Josh were really cool.
Yeah, Josh is a good.
Yeah.
He's a good dude.
And he followed the rules too. You knew you weren't going to get in trouble with Nick. Like he was good people, and
Yeah.
so I recognized that. And
We can still have some fun
yeah,
without getting in trouble.
100%.
All right?
He's not boring, but
Yeah.
no, he was. And I like the game that he played
Yeah.
too. Like he very similar like game styles,
Yeah.
very shooter
Yeah.
mentality, and
Yeah.
so
Yeah.
I would just say like sweet. Like he was smart, followed the rules. He was cool. He was fun.
Yeah.
Yeah.
Good. That's
Good dude.
yeah. All right.
You-
All right. It validates everything I was thinking.
Yeah, you made a good hire, man. I know you're still second guessing
I just,
it years later.
I needed another reference.
Yeah.
And she was
I
sitting
get
here,
it. I
you know
get it.
what
I
mean?
get it. I get it.
I can't
Pull
go
me
any
out of
further
the
back than
I
that.
get it, man. Yeah.
No, we had some time. I mean, because in basketball, we had to be back for winter break
Yeah,
too.
so
So
we
the
had a
men's
lot
and
of-
women's team, we were together around each other constantly. So
Yeah.
we were close.
Yeah, for sure.
But I didn't realize we were like geographically actually close in
I know. I didn't.
Massachusetts.
Yeah, that's actually not that far.
Either.
No,
Yeah.
No.
it took me like 25 minutes to
Yeah.
get
Yeah,
here.
it's not bad.
I
didn't
even have a
realize I
couple
did that.
patients like from Newburyport. And I
Yeah,
was like,
there you
oh my
go.
God,
Yeah.
Perfect.
that's cool.
No, that would be. I mean, that's great to have that reference. We
Absolutely.
should definitely get some cards from
Yeah.
you guys for sure before you
Absolutely.
go. You have any other questions for Riley? I mean, you had
No, the
some
only-
on there.
The only question, well, we should ask the one question we ask everybody.
Yeah.
The one thing I was going to talk about just because it's coming up is the Tough Ruck. You're doing
Yep.
the Tough Ruck.
Yes.
Oh, you're doing the tough rock too?
I am.
Proform is
Come on.
Proform is kind of doing it.
I'll be
'Cause
there in
Chad's not.
spirit.
The face of Proform is doing it.
That's
Yep.
right. That's
You
all we
know.
need.
And then Hayden.
That's all we need.
Hayden's kind of like a new face. He's
Yeah,
coming
yeah,
in.
yeah.
And then, Chris is doing it as well. So
Oh, that's awesome.
yeah,
so
so we'll have,
75% of the office is doing
much,
it.
Yeah,
Yeah,
pretty
yeah.
much.
Oh, okay.
Yeah,
Yeah.
we have another. She's on maternity leave right now, so she's not going to do it. But she probably
She would have.
would do
She
it.
would have done it.
Although I don't know if she can't. Like she won't. She's go. So like being out and doing one thing for numerous hours might not be up her.
Yeah,
Totally up
maybe
her alley.
not.
She might just be like, "No, it's too long. I don't want to do that.
Yeah.
Let's go sprint it. Let's go
Yeah.
sprint a fraction of that distance."
Yeah.
So yeah, we're doing the Tough Ruck. How have you been training?
Every Saturday, I ruck 20 pounds. It's been by myself recently. So my fiance was doing it, but he actually has a hip replacement.
Oh, wow.
He got his hip replaced when he was 25. So as he got into like 10, 11, 12-mile range, like it's weird for him.
Yeah.
Like it was kind of hard for him. He's still going to do it, but the training has been
Yeah,
more on me. The hardest part is being out there for 4 hours
I
by
know.
myself.
Actually, by yourself's tough. I'll give you that.
I haven't
That's
rucked
hard.
with anybody other than him. So like
Yeah.
it's just me. And so I was like, oh man, this is some therapy. This
Yeah.
is something that I don't want. But no, it's been good. It's been pretty rewarding.
Yeah.
You know, I didn't think I could do it. I've never done anything close to a marathon. Never done
Sure.
a half marathon.
Yeah,
I don't even remember. I think the 5K, the only thing I've done was like the breast cancer 5K that Coach Graves would make us do in Springfield. Like that's probably and we walked that. So that's probably the longest.
Oh yeah, we did the same thing.
I'm in the CrossFit realm. Hayden will probably confirm this. I'm not an engine. I am very much a strength specialist.
Totally.
Yeah.
I'm not running around. I'm not on the rig. So I will be walking that. My goal is I would love under 7 hours.
Yeah.
But if I could rock between 7 and 8, that would be.
Nice.
I want it under 8 for sure.
Did you get the schematic? Did you get the schematic from the Tough Ruck?
No, you have the schematic.
No, we don't.
She knows what I'm talking about.
Yeah. Okay.
So hey, you know what I mean? Hold on. I just want to take a minute and I want to enjoy this because listen, she looked right at you and she goes, "You got the schematic?" She knew exactly what I was talking about.
I never said that. I never said that that's not a thing. I just said you could just say map check. That's all I said. I was like, we don't know what the course is yet. We don't know. I was like, no, what's a schematic? What's a schematic look like? And they're like, schematic? We're like, dude, just say map. Just say map. Like,
wait, did you just not know the term? You knew
no,
he
knew it.
but in the reference of
immediately as soon as he said the word schematic, we started laughing, and he was like, "What is that? Is that wrong?" And we're like, "No. You can just say map. Though. Like we don't need to say schematic." I just literally like just hadn't heard that. You know, like knew what it was, hadn't heard it. And
did
I was
you just
like,
age yourself? Cool.
Yeah, I think that's what happened.
Yeah,
I mean,
I said, man, you are just a level of. I didn't realize how many levels you were above everyone else.
That's
It's
right.
Just, yeah,
That's
you know?
right. That's right.
It's just like, wow.
I have a question for you. Are you going to compete in bodybuilding?
That's a good question, actually. I'm not sure. Possibly later
Everybody's
in this
waiting.
year. I know.
That's what I'm saying.
Possibly later this year. So the story behind that is last year I could have done physique, and I was like thinking about it, and I was like, honestly, I just kept on bitching out. But I really want to do classic. That's like my ultimate goal. Now, I was talking to a few people last year, and they're like, Chad, if you want to do classic with your height, you need to put on a solid 10 to 15 more pounds. So that was my goal this year. So I put on a solid 45-ish, 50 pounds.
10 to 15, dude. You put on.
Really?
In the last like 7 months.
Yeah.
Wow.
So
it's insane.
yeah, so I'm hoping that when I dial it back down, probably in the next 3 weeks, I'm hoping to get down to about 235. That's what
Wow.
I'm hoping.
Okay.
Last year I was about like 225-ish. So I'm hoping I can get 8 to 10 pounds out of this.
All
We'll see
right.
what happens.
Okay.
But if I can get that and I can get like the thumbs up, then I might do something in the fall.
Nice.
We'll see.
That would be awesome.
Yeah, for sure. If not, then definitely next year.
Okay.
You know, but I can't wait
Because I
too
feel
long.
like you need one thing this year. Like if we have the tough route.
Yeah. So that's
You
my
need a
thing.
thing.
That's my thing. I'm not a CrossFitter. I'm clearly a bodybuilder.
Well,
and
tough rock is just walking, dude. You can walk.
I
Fasting
can't
cardio.
walk right now, Nick. You don't understand, bro. Like, I literally get exhausted brushing my teeth in the morning. So we literally took a power class last weekend, and I don't know if you know Matt Ibrahim. So he's at Endicott College, and there was a sports performance clinic.
Marco Sanchez was there.
Yeah, Marco Sanchez.
yeah.
Marco used to own the gym that was next to our office.
cool.
Yep. So I know Marco
nice.
very
Yeah,
well.
Marco's
yeah.
a great guy. Yeah.
Mhm.
So so literally within like probably 10 minutes of just doing some speed drills, and I say speed drills, I say that lightly. It was like mobility, and then we were just doing a couple hops. I think my heart rate was up to like 150 beats per minute. And so we got to like the end of the day, and it was like power. We had to do like jumps, and I'm not a big jumper. I don't really care for it. It's not my forte. And I was like, I'm gonna sit this one out because my knees were killing me.
I saw the first two-legged jump over a hurdle. It was over like the medium-sized hurdle.
Yeah.
Just the landing looked it just looked painful. The jump looked fine.
Yeah.
Like all the mechanics, everything was on point. Like people gotta understand Chad's not he's a adequate athlete. We'll call him an adequate athlete.
I'll take the adequate.
80% at everything.
In terms of like he can model everything, he can
That's
do
right.
it, he can show you one rep, and he's not gonna fall over doing it. But in terms of like the jumping, it just looked painful, and I was like, oh man.
When we did the single, it was like
stop
single leg hop.
Yeah, it was like, oh man.
I literally I literally thought I was going down.
It sounds like so. We
It's
also
too much.
And I was wearing the Vivo, so it was like, boom.
Yeah.
no cushion.
Yeah.
We have something in our office. I don't know if you've heard of it. We have SoftWave.
I have heard of that. Is it like an ultrasound or something?
Yeah, so it's like
Yeah,
nice.
ultrasound. Chef's kiss for knees.
Interesting.
Yeah, so it's an ultrasound. It decreases inflammation, decreases swelling, but it taps into the stem cell regeneration of the bone marrow. So it's an ultrasound with a spark plug in it, and it propels the sound wave deeper into the tissue. And so we use it in our office. It's diagnostic as well as a treating tool. So say you have knee pain. You can go over like the MCL, you have nothing, but as soon as you go over like the patellar tendon, if it inhibits pain or if the patient experiences pain, you're like, oh, that's where your damage is, that's where your inflammation is, that's where your tissue damage is.
Yep.
So it's really good. I'm just saying.
I think that was probably
She's selling.
so.
it.
She is.
How good am I?
I know. I mean, since we're on the topic of ultrasound, that was probably the last time we used that ultrasound machine.
Yeah.
When we had a patient came in that was questionable fracture of like their ankle,
we wanted to see if
and
they
I was
get
like, well,
any,
let's see what happens.
discomfort,
And the ultrasound confirmed it. And I was like, yeah, this is definitely broken.
I don't know if SoftWave would appreciate this, but they have
Yeah.
a lot of research for erectile dysfunction.
Whoa.
Yeah, but no,
Interesting.
but it really is good. I've done it on
I
my
mean,
shoulder.
if it's painful, that kind of sucks.
Yeah.
I don't know
It's
what
like,
it
whoa, whoa,
is.
That's it. Yeah, that's it. That's
the
the problem. That's the problem area. That's the problem area. It's like, oh,
It's
we
broken.
probably could have asked you a couple questions, but we'll just go right to it.
But I've done it on my shoulder, ankle, knee. Really, really good.
Yeah,
So
nice.
if you guys want to check out the office,
Yeah, no, totally. We would love to do
Yeah,
that.
sweet. Yeah, we definitely come by
For sure.
Yeah.
No, it would be great because we would love to have that connection with you guys because we're always asking, people are always asking us, who do you guys recommend for chiropractic? Who do you guys recommend for massage and all this other stuff? So we have one in the area, but you never know. Like, it's not everybody's thing. You know what I
Like
mean?
I said,
So
just because I'm a chiropractor doesn't mean you want me touching you,
That's right.
and like vice versa.
Yeah,
Back to
yeah,
the touch
yeah.
thing.
yeah,
You know,
Yeah.
totally.
Yeah.
1,000%. There's somebody for everybody. No
Yeah.
doubt about it.
absolutely.
So what's that one question you got to ask?
Which one do you want to want? The
Oh, no.
bang for your buck exercise or the one piece of health advice?
Oh, okay.
No, let's do the bang for the buck. That
All
one
right,
makes you think a
all
little
right,
bit.
all right.
Okay.
You can only pick one exercise.
Okay.
That's it for the rest of your life, or to give out to people. What's the best bang for your buck exercise?
When you mean bang for your buck, though,
One exercise.
Just
I know
one exercise.
one exercise, but health wise, strength wise, to just crush you wise.
That's up to you.
That's your call.
That's up to you. What's
It's
the
your
most,
buck.
What's the most
My buck.
pertinent thing?
So the most pertinent thing is hitting the most body parts you can
Okay.
Mhm.
in a functional way
Okay.
Okay.
that can help you in all facets of life.
I like it.
All right.
Okay.
So,
Sounds great.
what is that exercise?
I am thinking, give me a hot
I
second.
mean, we agree with you 1,000%.
It would have to be, I'm going to go CrossFit with this one, a man maker.
A man maker.
Man
I don't
maker.
think I know what that is.
Stop
All
it.
right.
I
So,
swear to God.
so dumbbells down into a burpee. So you practice getting up and down off the ground, which I always wanted to tell you that your couch fast a couple of years ago, like really intrigued me. I still talk to patients about that. Anyway, it's a
Nice.
skill getting
Love
up and
it.
down off the
Oh,
ground.
totally.
So burpee, chest to deck, get up, swing it up into a clean or a squat clean. So, and then a thruster. So overhead work, a squat, getting up and down off the ground, dumbbell.
Nice. Unique answer.
Yeah.
All right.
Interesting.
And I saw that on the
Alright,
question and I was like
interesting.
thinking about that today and I
Man
still didn't have
maker.
an
Man
answer. And
maker.
plus it has a cool name. It's
I
a man
like it.
maker.
It is really cool. I've never seen that before, heard that before.
Yeah.
That's awesome.
So that's why I'm
Well, yeah, we haven't had that answer before. We get a
Good.
lot of
We had a good,
deadlifts,
like,
like hip
deadlifts.
hinges,
Yeah.
split
Yeah.
squats,
a lot
kind of
of
stuff.
carries.
Carries.
We
you
had,
get a hip hinge with a man maker.
we
Just saying.
had Turkish get up one time.
That's a good one.
Yeah.
If you like
Or-
Turkish get-ups.
I feel like yeah.
Who likes Turkish get ups?
Nobody. I hate them.
Yeah.
Nah,
I do enjoy a nice Turkish
Do
get
you?
up. I'll be honest.
I do
yeah.
the quarters. I don't do the whole. I just don't.
I just go with the whole. I do it as part of like my. Yeah. All right, guys. All right. So what I'll do?
No,
I'll do it a couple different ways. Okay. So I'll do it as part of like a steady state. You always love the word cardio, but a conditioning
No, I get
day
you.
where I'll do a get up right into like 10 swings on one side, boom, come back down on the ground, switch, get up, swings, boom, and just keep it going.
Yep.
Heart rate stays pretty steady throughout. Or sometimes I'll do it as just like a recovery day where I'll, through the parts of it, have a lighter kettlebell, and I'll do like, for example, on the ground, I'll do, a couple reps of the sit-up portion, then I'll do a couple reps of the hip thrust portion, then I'll do a couple windmills, just get the body moving, but keep it a little bit, just more loaded. So I'll go and, do a press at one portion of it, and then obviously you got the lunge, so you get a reverse lunge in there. So I'll just kind of do one of those two on a more of a like recovery rest day. But yeah, I do use them probably more than most. I'd say so.
Every day.
It's not my favorite.
Not every
I
day,
was gonna
but
say,
not
it's
every
not
day.
my favorite either.
No.
I go through phases where I do things every day, but I haven't done that one in a while. Most
Yeah.
of the time, it's kettlebell swings or push-ups. But
Yeah.
sometimes I'll throw in a little pull-up in there, like 10,
Just a little one?
just a little one,
Not
just,
a big one.
just a little baby one. You know the ones the high school kids do? That one. That the
Kicking
quarter,
their leg.
Not even a
Oh.
the
presidential
quarter
pull-up.
range, the quarter range.
Not
one's
even
like,
presidential.
Nah, yeah.
One
Nah,
time a
full
strength
range, baby.
coach
Yeah.
made us do girl pull-ups, which you had to swing your leg. I know that's not like
What is that?
technical anymore, but you had to swing your legs like as hard as you could, and it was like an
Oh, what?
eccentric pull-up.
I feel
And
like
you
that'd
had
be
to go
worse.
as slow as you can go, and just kick your legs and flail all over the place, and just do like one as hard as you possibly could.
God.
Just make it more challenging.
Just make it
Yeah.
more challenging in
That's so
every
funny.
way.
Interesting.
Yeah.
Yeah, that's definitely more challenging. I wouldn't want to do that. I just do the regular.
Tempo though, right?
Tempo is king.
Tempo.
He is the king of tempo.
Yes,
There's no
you're
doubt
damn
about
right.
that.
People make fun of me all the time for it, but bam.
It's true. You do crush the tempo.
I love tempo. Live by the tempo, die by the tempo. That's what I always say. All right, I think this is a great conversation. If there was anything else, do you want to mention anything else, Riley? Is there anything coming up that you want to mention?
Oh man. Well, with the pediatric
Yeah,
like stuff
sure.
too. I mean, I could dive into that like all day, and I feel
Sure.
like that would be another
We could
conversation.
do
for,
a
like,
separate like pediatric specific one. I
Totally.
think. I
Yeah.
think that'd be worthwhile.
That'd be
for a
awesome
lot of
because I feel
people.
like not a lot of people know
I didn't
about
even
that.
knew that you did that.
Oh, I'm sorry. Yeah,
So,
my
that's cool.
specialty is pediatric and pregnancy based
Oh,
chiropractic.
Okay, that makes sense now.
So I
Yep.
adjust babies all day long.
That's
which is
great.
cool. I had an 18-day-old the other day.
Oh wow.
Yeah. So I could dive
Wow,
into that.
kudos to
Yeah.
mom for bringing the 18.
Yeah.
Mom's
Yeah.
typically under care first,
Yeah, for sure.
Totally.
and
But
then
that's-
they'll bring the
that's-
baby
that's
in.
big
But
time, yeah.
youngest I've ever adjusted was I think 7 days, a week old.
Dang.
Wow.
That's wild.
It's pretty cool. That would be a cool thing, like if Theo was here or something like that.
Yeah.
You know. Yeah.
Maybe we should do that on the next one. Just make it like
Make
a
it live.
make it
Yeah.
live, man.
I
Or
like
like
that.
get it
I'll
on
bring- I'll
video
bring
where
Theo.
she does something really cool with Theo.
Yeah. I think Theo.
Yeah.
I just want to see Theo.
Yeah, absolutely.
He's a cute
No,
kid.
bring him.
I will say that.
But
Kid's
yeah,
cute, so.
no, but that'd be awesome. This was cool.
Yeah,
So
absolutely.
I really appreciate
So
it.
where could people find out more about In8 or maybe about yourself, whether
Yeah.
it's like Instagram or website, email, that kind of stuff?
Instagram is usually where I post most of my stuff. Dr. Riley_fake. And then In8 Wellness Center, North Andover has their own Instagram as well. But In8 Wellness Center, Google. We have a really in-depth website, says everything that we have and what you would need. You can book right online there if you want to consult. And
I love it.
Sweet.
Well, thank you for coming on the podcast.
no, thank you so
Riley.
much,
This
guys.
is great.
A lot of fun.
Appreciate it.
I'm looking forward to round 2.
Let's go.
It's going to be a good one. Let's go.